Why is LTK eye surgery less effective than LASIK eye surgery in managing hyperopia? Before I proceed on with my model, let's establish what LTK is. LTK, or laser thermokeratoplasty, is essentially a procedure used to treat two eye disorders known as astigmatism, which is a common visual condition causing blurred vision, and hyperopia, where the lens of the eye is too elongated, altering the location of the focal point behind the retina, making objects in the close trajectory range blurry. But today we will just focus on hyperopia. Prior to LTK procedure. Prior to the procedure, the patient will meet with a coordinator that will discuss what the patient should expect during and post LTK surgery. Throughout this surgery, the patient's medical history will be evaluated. Along with this, their eyes will be tested by measuring the patient's corneal thickness, refraction, and pupil dilation. Once the evaluation has been completed, the patient will then meet with the surgeon, who will answer any further questions the patient may have, and then follow along with the scheduling of an appointment for the procedure. Patients that may wear rigid gas permeable contact lenses are advised to not wear them for 3 weeks prior surgery. Other types of contact lenses are also advised not to be worn 3 days prior to the LTK eye procedure. On the day of the surgery, patients are notified to eat a light meal before heading to the venue of the procedure, not to wear any eye makeup or have any bulky accessories in their hair that will interfere with the positioning of their head under the laser, and to provide all prescribed medications along with their eyeglasses. LTK procedure. After the patient has undergone the local anesthesia and the procedure has commenced, a laser beam will utilize heat to shrink and reshape the cornea of the patient, which is the protective and transparent outer layer of the eye located at the front of the eye on top of the lens. When this has occurred, any visual problems such as hyperopia should be corrected within a matter of seconds without any cutting or removal of the patient's tissue. Post-LTK procedure. Doctors after the LTK eye surgery tend to organize various follow-up appointments, most commonly a day, a week, a month, and 3 to 6 months after the surgery, to prevent any infection or irritation that may occur. And patients will be supplied with antibiotic drops as well as anti-inflammatory drops. LASIK eye surgery. This is unlike the more common laser eye procedure of LASIK, or laser-assisted in situ keratomyoleusis eye surgery, which specifically is utilized to treat 3 visual disorders known as astigmatism, myopia, and hyperopia. But as previously mentioned, we are just looking at hyperopia. Prior to the surgery, an eye doctor will perform a thorough eye exam to ensure the patient's eyes are healthy enough for the procedure. The doctor will determine the healthiness of a patient's eye through evaluating the pupil size, refractive errors, shape and thickness of the cornea, as well as any other eye conditions. Along with this, the tear film on the surface of the eyes will also be evaluated, and a precautionary treatment may be recommended to reduce the risk of developing dry eyes post-LASIK eye surgery. Patients will also be required to stop wearing contact lenses if they do wear them for a period of time advised by their doctors, as these contact lenses are capable of temporarily altering the natural shape of the patient's cornea. After all the events mentioned previously are done, the patient will be capable of going under LASIK eye surgery. LASIK procedure. After the patient's eye has been applied numbing eye drops and their eye has been positioned under the laser with the lid speculum keeping the eyelids open, surgery has initiated. The surgeon will mark the cornea with an ink marker before utilizing a microkeratome or a femtosecond laser to create a small flap in the top 20% of the cornea, that they will then proceed to fold back the hinge flap to access the underlying cornea, also known as the stroma. A suction ring is applied to the front area of the patient's eye to prevent eye movements that may interfere with the LASIK procedure, or loss of contact that could affect the flap quality. When the flap has been created, surgeons then use a computer to adjust the excimer laser for the patient's specific prescription. The patient will then be asked to look at a target light for a short duration of time while the surgeon watches the patient's eye through a microscope as a laser sends pulses of light to the cornea. This laser light pulses painlessly to reshape the cornea of the patient, although the patient may feel some pressure on their eye. All these steps of LASIK eye surgery will then be performed on the other eye, as each eye is performed separately, taking only about 5 minutes. Post-LASIK surgery. Upon completion of LASIK eye surgery, the surgeon will advise patients to rest. Patients may also feel a temporary burning or itching and should accept some blurry vision and haziness immediately after surgery, although clarity should improve by the next morning. Doctors will advise to refrain from any strenuous exercise for at least a week, as it may traumatize the eye and affect healing. Along with this, medication will be prescribed and checkups will be scheduled to observe the results of the surgery. Results on hyperopia. Both LTK and LASIK eye surgery manage the hyperopia eye disorder. Although LASIK eye surgery is much more effective in managing hyperopia as opposed to LTK eye surgery. This is due to the result duration of each surgery, where post-LTK surgery results tend to be highly effective in managing hyperopia during the short term, although in the long term, vision of the patients gradually regresses to its initial state, generally lasting roughly 3 months and costing $2,000 per eye, which is not much cheaper than LASIK eye surgery. Post-LASIK eye surgery results, where the permanent reshaping in the cornea occurs, can last up to 20 years or more and generally costing $2,249 per eye. Therefore, LTK eye surgery is less effective than LASIK eye surgery in managing hyperopia. And now I'd like to ask you the question of, if you were an individual with this hyperopia eye disorder and were exposed to these facts, which procedure would you favor?